Hello friends, and welcome to another episode of Better with myself, Charlotte Wagerhall. You can also find me as Skinny Schedule on YouTube, Instagram, Facebook and Twitter. On today's show we have Adam Sui. Adam is a musculoskeletal therapist and occupational therapist. Adam is a big believer that you don't have to live with pain, and it's all about realigning your positioning to have your best life. In today's episode, you're going to learn about how men and women differ physically and how that can lead to different injuries, whether your condition warrants seeing a physio, and also, interestingly, how your cycle affects your sporting performance. So this episode, stay tuned, you're going to find out how to prevent lots of different conditions and live your #best life. So a big welcome onto the show, Adam Sui. So a big welcome on the show. It's an absolute pleasure to have you here. So with your background, your interest in this area actually started because of what you experienced as a teenager. You started to see back pain, was it?
Yes. First of all, thanks for having me. I'm very excited to be on this podcast. So I started with back pain around 16. So when I started going through puberty, to be honest, so growth spurt for me, and I'm kind of the rare sort of Chinese breed where I'm quite tall, so I have a long spine, so that sort of started me with back pain on my left side. And then so I saw a physiotherapist privately, and got some treatment and advice from them, and it helped, but it didn't really cure it, or the pain kept on coming back. So at the age of 17, when you go through school, you just study and then you get your exam results, but you don't really know what you want to do for the rest of your life. So I did loads of research regards to what I wanted to do. So I went through the UCAS application and went from A to Z, and I came to physiotherapy, and it was just like ticking all the boxes for me. It was practical. I've always wanted to help people. So, so I ventured down that route, and eventually saw myself become a physiotherapist after 3 years of doing undergraduate, because I couldn't get in straight away, because I kind of realised I wanted to be a physio a bit too late, according to the university, because I didn't have any work experience in regards to...
So you have to have work experience before you apply, even though you've got your A-levels?
Yes, definitely. So that was something I was really... confused about, to be honest, but yes, they looked heavily on people that have done work experience in a caring role. So it could be, some charity work, or working in a hospital, obviously.
Yeah, which is quite interesting, because given that a lot of the time when you go to university, the majority of time, of course, there's mature students as well, but you tend to be sort of 18, fresh out of school, A-levels. There's not really necessarily an opportunity to be able to get into like a caring role. Yeah. So you managed to gain some experience. You went on, you graduated, and then what did you do once you graduated?
So after my undergraduate, which wasn't physiotherapy, it was sports science and physiology.
Okay.
And during that 3-year course, I just knew as I was doing the course that I wanted to be a physio, and it just kind of inspired me more. So then I took a master's degree in physiotherapy, which is a shortened version of the undergraduate, in a 2-year degree at Leeds. So I went to Leeds Uni for the undergraduate and Leeds Met for the postgraduate. So following that, I need to become certified as a physiotherapist or chartered. You need 1,000 hours of clinical experience. So you do 6 rotations in 6 different hospitals in 6 different areas of physiotherapy. So I've obviously come out and specialised in musculoskeletal and occupational health, but you do need to have a whole-rounded experience in respiratory, working on the intensive care unit, neurology. So also when I was doing my interviews first time round, I obviously was emphasising that I wanted to go into musculoskeletal and the sports side of things, but at university they look for actually just a caring person, an overall caring person.
Yeah, well, it's just what you need, isn't it, when it's a caring job? So with your so for someone who's listening and thinks, so what does that mean? Like musculoskeletal and sort of occupational therapy or occupational health?
So musculoskeletal obviously refers to your muscles, your skeleton, and any ligaments or any soft tissue stuff that's on the outside to not inside. So like say if you would go see a GP or a doctor for like internal stuff like your lungs or your heart or your liver, but for musculoskeletal it'd be more like muscle injuries, so for like sprains, strains, repetitive movements. So occupational health comes into that, because in our jobs we do repetitive things every day that puts strain on our bodies, and that actually ends up having pain. So most commonly in the neck and shoulders, lower back.
And what's the main cause of that then? Is it sort of like typing? Because we have a lot of sort of computer-based jobs now.
Yes,
what we're used to. Also, you're getting like selfie repetitive strain injuries. I think the Kardashians have probably got that.
To get the perfect angle, definitely. It's not just typing, but it's just more being in one position for a prolonged period of time. And we were just talking about this before the podcast, to have good posture.
Yeah, I feel like I should be sat up really upright today.
And actually, good posture doesn't mean upright. It doesn't mean slouched. It doesn't mean, you need to be brilliant. It just means you're comfortable. But we find a comfortable position, which is usually in a slouched position, and we just stay there for 8 hours.
Right.
Let's say we're behind a desk or whatever. But actually, we should always be changing our postures, and that's what good posture is. Actually, it's dynamic, it's flexible, it's moving between the two. So
didn't know that, because you just told that good posture. When you're a kid, you sort of get a bit of a nip. You've got to sit upright.
Yeah, definitely. So it's the extremities, and that's the thing with I suppose with you and in your world, is that it's not the extremes, and I think that's why something was so popular, is that you don't need to be really tight with your diet. You don't need to be very loose with your diet.
Yeah.
You just need to find that happy medium.
Yeah,
and actually,
balance.
I always say it's a lifestyle.
Yeah.
And so the same with your posture, is that as long as you know where you need to be there for about 5-10 minutes, and then slump back down into that more comfortable position, and just keep changing.
That's really interesting, because no one's ever said that before. It's so around. And like one of the other reasons sort of why you're on as well, like for me, we're at the gym and there's a big group of us that sort of go, and like some of the big classes, like there was a military circuits class that we like. And the reason why this sort of how a premise of this idea of coming up on the show came was that it literally, we are like an army of like mutant zombies. We're all sort of like got these injuries, like knees, and now it's got to a point where the instructor's saying, has anyone got any new injuries? Because we're all like walking around with like different injuries. So it's sort of like going through what were the most common injuries and how do we prevent some of these as well, particularly with females, because that's the majority of people watching at the moment are female. What we'd like to do is, because it's such a wide topic, we've already spoken about this. I'm not discounting men at all. We're just going to split it into 2 episodes where we focus on sort of women's health and physiotherapy, and then on another episode we're going to split more into male, because there's just so much to cover, isn't there?
Course.
And different as well, which I've never really sort of thought about before. But anyway, I'm talking too much. I'll let you get onto the first bit.
So the most common injuries are for women mainly, and research has backed this, is actually knees, hips, lower back and feet. If we're going to talk about the lower half actually today, and then shoulders are also a very common injury for.
I've got both. I've got a knee and shoulder, so I take both boxes. So what? I don't even know where to start. Feet. Why feet? Is this because we're all wearing too many high heels and then we go over on them, or?
So plantar fasciitis is probably the most common diagnosis for the feet. So that's pain under the arch of the feet. So if when you go on like a night out, you wear heels and you come back and you just like your feet are just so painful, and a lot of people take flats out now, which is great. But it's when you're forced into like having a high arch constantly, your body will just fight back and then slump down.
Right.
So you will have flat. So research has shown that feet and women have flatter arches, but that's not just because of laziness, but it's because of how you actually were born, and how females' bone structure are actually different to males, and actually how you use your bodies are different to how men use their bodies. And as we discussed before, in 1972 was only around the time when women or females were allowed to participate in sport at school. It's
not even that long ago, is it? I didn't know that till you mentioned that.
Yeah.
It's scary.
And so I guess through evolution and stuff, men were at a younger age more used to physical activity, running, playing sports to females. But obviously, as you know, that females sport is becoming so popular, and it's great actually. It's great to see how females are becoming more sort of strong and independent. But going back to your questions,
So with the feet, we're
The feet,
So
yeah.
what's causing the feet problems that are common now then?
So when you talked about common injuries of you guys walking as in a army of zombies with injuries, and that's what makes it so complicated with physios, because yes, you go to class and you've got injuries or pain, let's say, in joints, and you just accept the fact that it is there because you are working out, which is fine, and you see, and I see people in the gym, like they'll do a bench press and they rub their shoulders and then they'll do another 10, which is fine. But actually, the body is so clever that pain is actually telling you that there's something kind of wrong there. So we tend to ignore them, which is fine, and we can carry on and we can do still a good session. But then we carry on, and then we burn our body out, and then it becomes a bit more severe. And so then you go and see a medical professional, and it becomes a little bit harder because you've put up with it probably for 6 months before you've actually gone to see help. And men are worse, and that will be coming on the second podcast. But females will go and see help usually, but we leave it, and then it's like, as a professional physio, you need to pull back the layers again and find out what the underlying problem is.
So really, if you're starting to feel pain, and I guess it's hard, isn't it? Because how can you, is there a way of determining whether what you're doing is sort of like it's challenging you, so it's hard, as opposed to pain? Because sometimes, I find it painful, but is it painful in a detrimental way? Is it just that I'm growing and testing myself? Is there a way of determining, I shouldn't do that?
That's a very good question. And people that have left or have chronic pain, which means they've had pain for more than 6 months.
So chronic pain is defined
by the research? Yeah, it's defined
time. So it's not actually the level of the pain; it's more the frequency.
It's more the length of time that you've had that discomfort and pain. So at the moment, it's classed as more than 6 months. And as we discussed before, before you go and see a medical professional, you might leave it for a month or two already, and then you go and see whoever next. And then before they start, really investigating, it's already gone 6 months. So then already a lot of people in this country, and obviously a lot of money is spent on people on chronic pain, are people that is longer than 6 months. So
I feel like I'm sat here and going to get told off now. Mine's definitely been going on for longer than that. God, that's crazy. I didn't know it was the time frame. So is there a way of knowing then, like if you're doing something whether I should be doing this? So if you feel a sharp pain, is that like stop what you're doing now?
Sorry, going on a tangent all the time. So when somebody has chronic pain, what we developed as well with the medical advice, we start to fear the pain. So a lot of my treatment actually is to make people more confident with pain. So when you talked about exercise related or induced pain, is absolutely fine and normal actually. And people that are in chronic pain usually fear that. And so they sort of avoid the gym or avoid activities that bring on that pain. So how you would feel would be, is a little bit delayed in terms of exercise induced. So you've done your exercise routine and it's usually the pain a couple of days after. Whereas something where you might actually think, I need to stop this, would be, like I said, a sharpish pain, a sudden pain, something that doesn't feel right. Yeah, and because if you worked out, you will know if it doesn't feel right.
Yeah, because sometimes I get that, and sometimes I think, for me, I'm like, do I keep going? Is it just me, my body responding, thinking, I'm challenging my muscles to grow in, or is it actually I shouldn't be doing that? And with my shoulder, I normally can tell when I need to. I'm like, it doesn't feel quite right, but sometimes I do push through it, which I know is wrong. So I'm glad I've got a bit more sort of clarity on that, and people just need to go and get help sooner, is what we're getting from that. So we talked about the feet, and there's a lot of problems with the feet, and is that caused from shoes then? Sorry, I'm not sure if I got that.
Shoes are a common one, and it's recommended by the research that you should maybe get some shoes that have more of an arch support, which allows the foot to be in more of its natural curvature. And again, for those, where can you get assessed for that? Probably a podiatrist, but also, sports shops, they can give you some nice advice regarding kind of the arch, especially for runners. And, females do tend to like to run. And again, on the research, is because you have type 1 fibers, which means the slow reacting fibers. Yeah. And that means you can run for longer and usually sustain an exercise for longer than men. And men will have type 2 fibers, which are more the strength and the power.
Yeah, they can go really fast.
They're faster, but they can't go as long. that might relate to other things.
Yeah, I was going to say, that sounds like we're going on to a whole other topic here.
To switch back.
So does your feet sort of, is it more, you get more problems with your feet? Is it because there's something going on upper half, like your
Yes,
hip alignment?
perfect, yes.
Or is it more that your feet you might be having too much of a flat foot, so then it causes problems up? Which one? Chicken or the egg?
Yeah, so a lot of people are different. So that's why physiotherapy, and that's why I enjoy physiotherapy, because every person that walks in is like a puzzle, and you've got to figure out what is their problem, what is their underlying problem, not what is their symptoms and how to calm the symptoms down.
Right, okay.
We need to find what the underlying problem, which caused the symptoms in the first place. So yeah, some people have lazy feet and have poor arches. Because they wear high heels every day, and then so when you take them off, your feet just go home.
Yeah.
A bit like when you finish work and a long day, you just want to go on the sofa and just switch off. Whereas some people, like you said, it might be related to the hip. So again, the research has shown genetically, females have a weird hip bone, a weird thigh bone where more of the bone is sort of in the hip socket, and the femur is rotated more medially, so it rotates inwards a bit. So if you can imagine, if your thigh bone is rotating inwards, it's going to make your foot go inwards.
Right, okay.
And so that's also a massive factor of why you have flat feet, is from the higher up.
Right. So do more women have flat feet than men? I've only ever known men with flat feet.
You don't know, or you do know?
No, I know a couple of men that have got flat feet.
Yeah.
I've never heard of a woman having flat feet, but then would they tell anyone, I guess?
Yeah, it's hard, I guess hard to say what is flat feet. So,
True,
how do you measure it? But it's basically, you might stand there with a nice arch, but when you're running or when you're doing squats or when you're doing your exercise, what happens is that because of your hip position, it forces the feet to drop down. So it's like, say you land a squat or you're landing your heel when you're running, your foot might fall in. And so that's why going to running shops and getting analysed whether your foot does overpronate or supinate. They're the common terms.
I'm lucky, I'm neutral for that one. It's
so
one of the few, I've done it. I recommend it because you can do most running shops do it for free as well.
Yeah.
I think it's really worth checking out because obviously it can cause so many problems. Yeah. Which then moving on to our knees, because that's the one that, oh God, mine are definitely tight and cracking. And like at the gym, that seems to be, for me and my friends and sort of the people I chat to at the gym, knees at the moment seem to be on trend, knees. So talk to me a bit about knees.
So again, it's so complicated. So the hip has that internal rotation where your knee makes your knee come inwards, and then your foot, the stability in there. And again, research shows because of your women hormones and estrogen, and also relaxing when you're relaxing is the hormone. So, aka it's relaxing your body. It provides more laxity in your ligaments. So your ankle stability is actually low. So you got low instability in your ankle. You got an internal rotation from your hip, which makes your knee come inwards. It's pointing in a disadvantaged position for biomechanics. So if you're running forwards, we want the knee to go forwards or front and back, not in and out. So again, unfortunately for females, you're forced to come inwards, and then what happens is in your shin bone, it makes it go outwards.
Right.
So you kind of got an opposing force on it, which causes your knee to have pain. So basically, it's friction in the knee. So it's basically doing this.
So how can you prevent that though? Because if that's sort of like your biology, how do I? If I want to go for a run or squat, how do I? Yeah.
So there's research now, especially in sport like netball or football, which a lot of females are obviously taking on. They class it as neuromuscular training, which involves more plyometrics and more jumping, but also with the advice of being in the best way to land. And again, research has shown that when men do a box jump, when you jump on a box, men will bend their knees as they embrace the load. So they will take the load by bending their knees, whereas women will land with straighter knees. Yeah. So what happens is that you're just pounding more force through your knees, and so then you end up getting knee and hip pain. So what we should do as physios and what we should do as personal trainers as well is when we land, we try to teach females to be more emphasis on landing with a squat. Right, landing with your knees bent, landing with into sort of a sitting squat position rather than landing straight, and just trying to reduce the impact through your knees. That's good to know. That's really good to know because I think thinking about watching people, we do that. And unfortunately, last week I was watching somebody doing it, and she was just and again, maybe going back to our evolution that we're used to, men are more used to sports, and we have less fear when we do stupid things, but actually research shows that women can take more pain, so they might be less fearful. But when you jump up, you feel that instability. So what you want to do is land your feet as quick as possible so that your legs might end up straighter. Yeah.
Right, I need to, it's going to be when I'm at the gym next, so you can see me thinking.
Yeah.
So sort of like crunching knees,
Yeah.
is that a sign of, is that something normal? Is that like, oh, you should get that seen?
Yeah. Just going back before with the knees. So we need to land a little bit more bent. And also when we land our knees, we need to focus on not letting them fall inwards.
Right, okay.
So you see women when they
Yes.
wear tight clothing or they wear sort of skirts or anything, they like to be more ladylike, which means their knees are in. Their feet are wide apart. So you're kind of like in a frog shape. So what you want to do when you're exercising, because obviously you've got sports gear on, you don't need to be ladylike, and you're probably sweating your head off. You just need to push your knees out further. So your kneecaps are aiming for your second toe.
Right, so if I'm squatting,
Yes.
my kneecap should be going for my second toe.
Yes.
I'm going to write that one down.
First or second? No, second or third toe. So your outer is better than inner.
And that will avoid...
That will avoid the inward motion of the knee, which you've already naturally got through your biology. You've already got inward knees, and obviously we hold ourselves with inward knees for females. And what you want to do when you're exercising or when you're running is or cycling, is just push your knees out slightly so that your knees are pointing over your second toe.
Right, got you.
And the cracking is because of that. It's because the knees are inwards and they're
Right.
not in their groove. So the patella sits between the knee and it should do this, up
Right.
and down. But what happens is that it comes inwards, so it does side to side. So your kneecap is just knocking over your knee bone,
Right,
and
okay.
it sounds horrible. So there's nothing wrong with doing that, as in terms of cracking. People that have that misconception, cracking means arthritis or it means damaging. It doesn't mean that. It just means that your knee is not in the right position. It just needs correcting, and hopefully cracking will actually reduce.
Ah, right, okay.
So actually, interestingly, I saw a client who did 100 squats at home. You know, females like to work at home sometimes with low confidence or whatever. So they do 100 squats at home, and they came to me with cracking knees and knee pain. So I said, how are you doing your 100 squats every day? And so that's like 700 squats a week, right?
Yeah.
So if you're doing it wrong for 700 times and it's causing you pain, it's not because of your cracking, it's because of your alignment.
Yeah.
So I said, push your knees out and start squatting like that. Come back and I did a few sessions, and actually within 3 sessions, her cracking reduced and her alignment was changed. And with change of lifestyle, it takes time.
Yeah, it does. Yeah. Definitely.
And so that was really interesting. And actually, for me, sometimes it's more of an experiment, and let's just see if that changes your
see if it
cracking.
works.
Because cracking, when you've had it for a long time, you don't know whether it's going to change or not.
Yeah.
For her, it actually changed.
So there's a difference between a crack and a crunch.
Yeah.
Because mine feels a bit crunchy, because there's cracking, isn't there? Like, it happens all the time, but like it feels a bit crunchy. Is that?
So going back to cracking, is it safe? Is it healthy? Because a lot of people say, your mums mainly say, don't crack your fingers.
Yeah.
It's going to arthritis.
Is it not something bubbles or something? Gas bubbles?
So it's sort of nitric oxide, which is releasing off your joints, and it feels good, right? Whatever feels good, you should always do.
Especially your back, when you crack your back.
Yeah.
Oh, it's a great feeling.
And obviously professions like chiros and osteos and some physios will crack your back as treatment, and it makes you feel great for the short term.
Yes.
So is it healthy? Yes, it's healthy. And there's a man who actually dedicated his life, 60 years of his life, on researching whether it is healthy or not. So what he did was one hand, left hand, he didn't crack. And then the other hand, he cracked as much as he liked. And then at the end of
the 60 years.
Yeah, that's crazy.
Wow.
Dedication. And then at the end of the 60 years, MRI'd both hands, and there was no difference in terms of joint health.
Right, okay. And is that study being sort of replicated, and sort of like, is there other studies like?
Yeah, so obviously there's many studies around, but with that one, if we critique it, there's only one person. So, how valid it is. But just going on, when I generally tell my clients whether it's healthy or not, I usually use that as an example, whether it is good or not. So that's cracking. Crunching and grating, I usually say. Grating. Yeah, so I don't know if that relates to yours, grating, or is it more crunching?
It could be grating. It could be, yeah. Definitely feels like it's not, for me personally, it just feels like it's not quite in the right place. And that's
you've
why
already answered it. So there's what physios do. And obviously part of the physiotherapy assessment is the subjective, which is the talking side. And you basically told me there that it doesn't feel like it's in the right place. That justifies or consolidates my thinking that your knee is probably not in the right place when you're exercising. Is it when you're exercising, when you go up and down stairs, when you feel that?
It was originally when I was exercising, then it sort of came home with me.
Yes.
And like as I'm sat now, I feel like it's sort of extended more. It feels like tighter.
Yeah, and generally you feel it when you go up and down stairs. So it's the kneecap just gliding over the wrong part of the knee, and that makes us that crunching noise, grating noise. So actually, again, if we change your positioning or make you more aware where you need to be on everyday life, and also when you're in the gym, it will just reduce that grating. And to be honest, that client had grating, not cracking. So yeah, her grating actually stopped because the alignment was fixed.
Because I think last time you because when it was milder, I think you said it was my LT band, which is quite common, I think, in women and runners as well.
Yeah, so that's called the iliotibial band, IT band.
IT band, I think I'll use. I remember that one otherwise.
Yeah. So what happens with the knee coming in? The body's natural reaction is to pull it out.
Right.
So we'll give it a lateral, which is an outer tug on the knee joint. And what happens is that is if you have obviously your knees coming inwards, all those years of exercising, the IT band will just keep pulling it out, and they will get tired, and they'll give you pain. And so loosening off the tension in the IT band will help relieve the pain or the tension in the knee.
And foam rollers quite good for that.
Yeah, foam rollers are great, and obviously they become very popular.
Yeah.
It depends on what level you're on. I really enjoy the pain now, but yeah, IT band never gets easier.
Yeah, it's quite a grimacing one. I think you did a little video for you putting on with your IT band. I thought that was really brave doing that, because my face would definitely not look that.
Yeah, I try to keep a calm face with that. But yeah, it's a band because it's not a muscle. So it's a very long ligament / tendon, which doesn't contract or react. It just sort of, like elastic band, it just reacts to movement. So if your knee's moving in, your IT band will pull it out. So it's constantly moving in and out, and that's over time. There's tension in your IT band, and it's not the word. And a lot of people say tight. So like, if you have neck and back and shoulder pain, we say you got tight shoulders or tight neck, and I don't use that word very much because I use the word tension. Because like an elastic band, if you pull an elastic band to its end point, how would you describe that band?
I would say tight, but it's just tense should be the correct word, really.
It's taut, it's lengthened position, because if it's tight, you would imagine it to be short.
Yeah, sure.
Yeah, so it's more of a tension. So it's about resetting your tension levels in those areas where you're having difficulties. It gets a bit complicated, and I'm not even sure if I'm portraying all the biomechanics all correctly.
It's for someone who hasn't really got any experience of it, it's just interesting, like how everything that you're saying sort of like it links up and makes sense, but when you're not a specialist in it, you're not sort of aware. And hips are quite a big one for women as well, aren't they? Yeah.
So again, women, the way they're designed to give birth, so they need to have wider pelvis, and that's what makes the hip bone attach underneath a little bit more, so that it makes room for widening during birth. So that's the reason why women have those hips. And with that, what we do in physio, we can measure the Q angle. The Q angle is the angle between your hip and your knee. So how it measures, usually measured like that. So that's the Q angle between there. So your hip's here and your knee's here. So you see how that's inward?
Yeah.
Yeah. And so we can measure the degrees for that. And research shows that anything more than 15 degrees, you have a large Q angle, which could predispose you to knee pain.
Oh, right, okay.
So that's it. So if your hip's here and your knee's here, so obviously the internal and the side-to-side motions of the knee there can cause friction and pain. With the hip, similar thing, because it's not in a straight line, it's coming down, you can get torsion and pain in your hip. And generally what you feel is the piriformis and the glutes, tightness in your bum, basically. And deep muscle called your piriformis can get tight over time again. Let's say tense rather than tight, and it can pinch on your sciatic nerve.
Right.
So, and a lot of people know what sciatica is, obviously pain referring from the hip or the back down to your leg. And that can go as far as your feet, but most of the time it can go down towards the hamstring, back of the knee. And a lot of people treat the back for that because that's the most common area or the most...
And does that happen more in women then because of the hips?
Yeah, so I find that more sciatica is trapped in women's sort of hip area rather than the back area. So a lot of people that come in and go, I ain't got any back issues, I only have this sciatica.
Yeah.
And actually it's come from the hip and the piriformis.
And the Q angle. So
due to the Q angle.
that's really interesting.
Yeah, so piriformis is a symptom, but the underlying reason is the Q angle.
Right, okay. And there's not really much you can do about that, though, is there? Because that's, again, or is there?
So, yeah, biology-wise, you can't change the Q angle, but you can change where your knee sort of lands when you squat or when you run or when you go up and down stairs. You can just make sure that your knee is in a better position and try to reduce that 15 degrees so that it doesn't cause that friction. Wow. So, yeah, biology we can't change, but the way we move we can.
Which I'm really taking from this. And the other thing that was interesting, we didn't really get on to talk about, we were talking about women's cycles. And how that sort of affects your physiology. And tell me a little bit more about that, because that's a whole nother.
So obviously, when you're due, you release estrogen, and that generally reduces your bone density and also your intake of nutrients.
Okay.
So this will come into your world a lot more. Is that women are found to have less calcium and also vitamin. Let me just check.
Vitamin D, is it?
Vitamin D, yes. So, so then obviously they should see a nutritionist or some advice regarding the intake of that. So that can obviously affect your blood levels as well, and also your energy levels. So that generally, when you're on your cycle, then you should probably reduce your output, so you shouldn't exercise as much.
That's really interesting. So I was listening to, I think it was another podcast actually saying that you're strongest at the start of your cycle.
Right.
And that you should actually work out more. Although you feel like the least workout, apparently you're strongest. But from a musculoskeletal point, you shouldn't do it as much, or you should back off.
Yeah, again, everybody will have their own opinions about the situation, but because your nutrition, your levels are a little bit lower, then you should obviously be careful. Obviously, if you feel that you can and you have done, then feel free to. But if you feel like during that time you are very exhausted and you're very fatigued and actually you feel a little bit more vulnerable after those sessions, then you probably would want to skip those sessions.
That's interesting.
And maybe take it a bit easier. Yeah.
And so is there a peak during the ovulation part of the cycle?
Oh, you're going a bit too into the women's health now.
Is that too? I'm just wondering if that's when it sort of dips. Yeah. Because people sometimes find they have more energy then. I just wondered from like an evolution point of view, whether that's when obviously you're most fertile and therefore you might, I don't know, have more energy or more strength. Yeah. Because you attract the mates or something like that. Exactly. I just wonder if... So,
you do find that women do have more energy during that period. And again, if you feel like you go to the gym and you hit a better workout and obviously you feel more energetic afterwards, then always go with how your body feels. And everybody is different. So I would always treat somebody tailored to them rather than you must do this because of this. So always go in your own experience.
Got you. And like we were talking earlier, it's like for me, my personal experience was that I think, well, now I know it was chronic pain because it was for a long time. I'd had sort of shoulder issues and I got referred to someone who's really good. And then I went to a chiropractor because the other person had left. And how do you know whether you should visit a physio? So someone might be listening to this now, and we were sort of talking about this before, and you had a really good answer for this. So how do you know if your condition means that you should go and see a physio, or should you go and see a chiropractor or a reflexologist? Or
so and as a professional, you do not want to disrespect any other profession, but from a human treatment side of things, the body doesn't know whether it's a physiotherapist treating you or a chiro treating you or osteopath treating you or a sports masseuse treating you. The body knows forces and loads. So if you can recreate that force and load yourself following the professional advice, then the body will stay healthy. And so part of my treatment is I'll create a force and load on you or a maneuver or a stretch on you and it makes you feel better. I would say take that home and carry on doing it. In terms of who should see, you should always trial and error, I think. And like you said with yourself that you saw 2 physios, one was really good, one was not as good. You should, keep trialing and error and see what works out best for you.
I just wondered whether there was a sort of type of pain or, I don't know, like a symptom that would be more akin to one area than the other. But I think it's just what feels right for you.
Yeah, what feels right. And physios will probably spend more time on the soft tissue stuff, and then chiros will probably spend more time on the bony structures and the joints, and obviously cause the manipulation, which makes the sound of cracking. But we are now in the world where everybody's sort of integrating their practices to make the best practice.
That's really good.
And that is the best, I feel, and I want it to be a world where it's not any other agenda other than to help somebody's health.
Yeah.
And obviously with the private world, they might have another agenda, and obviously want you to come back for many sessions. So, and a bit like cowboy builders, they do exist. And, I'm not saying anybody's cowboy out there, but they can have those kind of treatments. So always give a session 3 times at least. And if the treatment makes sense and it's improving you or making you feel better, then carry on. But if it doesn't seem to me making a change, then I would say try a different one. And even within the same profession, you might see a physio and think, I've given physio a go, it doesn't work for me. You've given one physio a go, and somebody else might have. And
it's true because I definitely had a different sort of diagnostic from people that I've seen, so it's quite interesting. So what should you? Because I've thought when I've been sort of saw into like, is there a difference, for want of a better word? When should I know whether I need to go for a physio or for a sports massage? Is there any recommendations between the two of those, and how are you feeling?
So a sports massage therapist will have a limited sort of scope in terms of what hands-on treatment they can do. They can obviously treat your muscles and move your body. However, physios will have more scope, so they can manipulate your joints, manipulate your muscles, manipulate your ligaments, and just have a bit more of an awareness on the anatomy. Although there is some great sports masseurs and sport therapists out there. The difference is, hopefully, the physio will be like, right, we've done as much as we can from a physio point of view. What you should do now is get regular sports massage on your muscles. And that recommendation should be there. And we should have that mutual respect, to be honest, from a physio and a sports massage to say, right, that client is yours now. And again, when the sports massage feels like they have a limited sort of benefit on somebody, they should refer to a physio. So it's just mutual.
It's just going between, I think it's more of a case of like, who do you pick up the phone to? Initially,
I would say in that aspect then it would be to get an assessment from a physio, and the physio would hopefully give you an indication, a recommendation on what you should do for your injury, whether it should be sports massage every 6 weeks to 2 months, or you need some physiotherapy sort of manipulation, or some more in-depth sort of treatment.
Got you. And is there any more sort of advice you'd want to give to females that you just keep getting the same sort of conditions through, or any sort of, just sort of topics that you think, gosh, right, women, listen up, you need to start doing this? Like, obviously now we know about the knees and the squats, but is there anything else sort of lower body-wise for females?
So if obviously it depends on the level of sport. So most women are weekend warriors or circuit classes and body pump and all those kind of things, is to get your form right and your alignment right. And you would hope your personal trainer is keeping an eye on all that. But anytime you can improve your knowledge and your body awareness and alignment, so that you're just performing at the best position. And if obviously you feel great or you grind, then you're probably not in the best position. So you need to just change or play around with the positions. And there's so much resources out there, as we talked about before, going on podcasts or YouTube to say how to squat properly, or how to burpee properly, how to press up properly, so that you're in the best angles. So my only advice for anybody, human beings, females or males, would be to be in the most optimal position and how to find yourself in those positions. For me, I teach 6 points. So feet, if we talked about the feet, if you've got neutral feet, that's great. But if you have flat feet, then just roll your feet outwards as you're sat down. You can get
insoles to help with that, can't you?
Yeah, you can, but as you're just sat down, just crunch your toes up. And what happens with that? You do it now, Sean.
I'm doing it without even thinking,
And what's happening to your arch?
It's changing.
It's creating the arch. It's creating the arch. So when you're standing or when you're doing a squat, just squeeze your toes onto the floor. That creates an arch for you. As you do that, it's going to help with your knees and your hips, but then you need to be aware of where your knees are going with the crunch of your toes. So you crunch your toes, that creates the arch. As you squat, push your knees out to your second toe, and that should just sort all the alignment issues out. So just start doing that when you're doing lunges, when you go up and down stairs, when you're squatting. Just crunch your toes and then squat with your knees out. that's my advice for the lower half, to keep it very simple.
No, I like it. And I think you've just really you've made it sound so simple. Like, I've been sort of putting up with these grinding and crunching for a while now. And I think really I just need to change my positioning.
Yeah.
You said it so simply there, but we all put up with it. And actually, I think that was one of your big things about like living your best life, is that you don't have to live with pain.
Yeah, definitely.
Because I think that was something you were sort of almost like, you told that when you were younger, when you suffered with back pain.
Yeah. So don't get me wrong, I have my bad days and my pain comes back, but I have the knowledge, and this is how I treat as well, is to have the knowledge to self-manage the condition so that you can live your best life continuously. Yeah. But we definitely have flare-ups and stuff. And, you know, my back pain has been with me for now 14 years. But it doesn't stop me lifting, it doesn't stop me deadlifting, it doesn't stop me squatting, it doesn't stop me playing football. But it just, I know the treatment, the movements, the rolling, foam rolling, to release my tension, my pain, so that I'm back to my best life. Just go back to your original question, sorry about that.
Oh, you've lost me there. I think it was just about that you have to live with pain. I think I sort of got to the point of like, this is just from my original meeting with a physio, was sort of like, you're always going to have this, Charlotte. Yeah. So I've sort of, it's become a little bit like, we're just going to have to deal with it. Actually, there are ways of reducing it and making it a lot more manageable. Yeah.
So, So, you know, we get told when we go to the GP when we're about, you know, middle-aged, don't want to guess people's ages now, is that we have an MOT check.
What is middle-aged now? Like, because the age, you know, that's average...
True.
Oh gosh, what was it? Yeah, 86.
Ages, 86,
is it women?
Yeah, 86, 84, 85, something in the 80s now, not in the 60s.
Women are still higher than men?
Yeah, maybe because of the men's stupidness. But yeah, going to that we go to the GP and we get told diagnosis like osteoarthritis. You got to live with it. It's wear and tear your body. It's part of living. Okay, but we start to wear and tear at the age. You have a guess. When do we start to wear and tear?
Oh, don't. That's not going to be very... Well, I'm over 30 now, unfortunately, so I'm guessing from there.
So yeah, we might feel that we start to wear and tear, but no, we start wear and tear when we stop growing. So, you know, for men, it might be 21. For females, it might be a little bit earlier because you start...
6 for me, because I'm like 5'3".
So yeah... So
when we stop growing, my gosh.
So 21, we start to show signs of wear and tear. So we get the diagnosis of wear and tear at 40, and we go, it's wear and tear that's causing you pain. But that's been wear and tear since 21. So why we didn't have pain at 21?
I'm not sure if I'm feeling better about that or not. Although I'm still waiting for my growth spurt, so maybe I've not started my wear or tear yet. So any final wise words that you want to close on? I
think you asked me, what's the key ingredients to success? And I think with anything that we need to go through pain to get success sometimes, or sacrifices. So same with to get out of pain. If you've lived with pain for a lot of years, don't feel like there's one magic stretch or one magic advice or one magic pill or one magic surgery that's going to fix your pain. You've got to put the blood, sweat and tears, the sacrifices of, you know, waking up early if you need to get your stretch rehab in, or coming back home at 10 o'clock at night if you work long shifts. That's probably what's causing you the pain. But to come home and do your stretches and just put the effort in. It's not just one magic pill. It's not going to happen overnight. Yeah. You've got to fix those alignment issues. And again, I've just touched the topic very barely today at the surface. And it's about knowing your body. And a lot of people come to me and say, "You're the expert. Tell me what's going to fix me." And yes, I am the expert in the field.
You can advise.
But I want you to be the expert of your body.
And also, you've got to do it, haven't you? So if you're listening there and your physio has told you to perform some of those stretches, you need to do it and not avoid doing it, which I think will probably relate to quite a few people. So where can people find you? What are your socials?
So, I need to work on that. And obviously, you're one of my inspirations for that. But my Facebook page is direct to you. So number 2 and letter U and one word, physiotherapy. But I want to change that to down to you. Physiotherapy, hence the empowerment and the education and the lifestyle.
Yeah, I like it.
That at the moment it's direct to you because I do home visits, so that you don't need to leave the comfort of your homes.
Which is really helpful for people that really busy lifestyles that can come to you like at a time that's convenient.
With traffic, especially in this season.
Yes, definitely. Well, thank you so much for coming on. I'm definitely going to be realigning my squats, and if I'm filming it, I'm going to have to make sure it's definitely right if you're watching it. So stay tuned, guys, and thank you very much for coming on.
Yeah, thanks for having me.